After a long break, we're back with another episode of your AKT Podcast, which is hosted by WellMedic.co.uk. If you're new to this WellMedic podcast, I'm your host, Dr. Sham Mahmood, a GP and founder of WellMedic.co.uk. WellMedic supports you in three areas: applying for GP, passing the coveted MRCGP, and finally transitioning into life as a new GP. If you're yet to visit WellMedic, check out our website for great courses and various other free resources. Before we kick off our first podcast today, I'd like to share my heartfelt thanks to you for being a listener of this podcast. As of this recording, we've reached over 16,000 listeners. When I first started this podcast, I would have never thought that you would have all collectively listened to me for over 1,000 hours, which is well over 6 weeks of your combined time, and I'm ever so grateful for that. So for this podcast, we're going to kick off with a new question. And the question that we have is that you have an adult patient who has been discharged from hospital following acute coronary syndrome. Which drugs would be used for secondary prevention? So take a second to make some notes and then we'll discuss the answers. So the answers to this question are ACE inhibitors, dual antiplatelet therapy, which should be continued for up to 12 months. This is often aspirin and another antiplatelet. And one of the things that you may want to consider here is what happens in anticoagulated patients. If you want to know the answer to this, head over to my Instagram page, which is WellMedic Sham. Beta blockers should also be offered, and if beta blockers are contraindicated, then calcium channel blockers can be offered. Examples of this would be verapamil or diltiazem. So these are rate-limiting calcium channel blockers that are prescribed by their trade name. And finally, statin therapy should also be offered. I hope you found this scenario helpful. If you're looking for the best AKT questions, keep your eyes peeled for the WellMedic AKT mock course, which will feature over 200 questions with thorough explanations as well as hundreds of new learning points. This podcast is hosted by wellmedic.co.uk. We help GP trainees pass the AKT.